families, and actually this is how we first met Jim, through Broadway House, as we were talking to him about, well, let us understand how we can meet some of the families that you serve. And so our students will, by following these 3 to 5 families throughout their entire medical school curriculum, will begin to understand the roles of community, of family, the importance of housing, of personal medical history, mental health history, genetics, and then the role of the physician, but the role of other health professionals in determining health, well-being, and disease prevention. The other elements of our curriculum that are important in achieving our goals are, we will not have a distinction between the basic science and the clinical curriculum. They'll be integrated in the first 15 months so that our students are always understanding when they are looking at a patient as to how disease and health is occurring in that patient. They'll learn within an integrated curriculum in a team-oriented collaborative environment, so that many of the projects that they're involved in, they'll be learning with, say, physical therapists, etc., at the same time that they're learning with other medical students. They'll be utilizing the components of different evidence-based teaching methods, and they'll be learning to work with data so that they can be forming their treatment plans for patients based on a whole array of characteristics of that patient, something that none of us had when we were training in medical school. The other thing is that we're working towards, we as a profession, not just us, towards graduating students at a more individual pace so that students who are competent are able to get through school earlier. Medical school is really expensive. And so we have developed and are in the process of developing a competency-based curriculum so that individuals will be able to proceed to some extent at their own rate. But until we have finalized that, we are going to have a 3+1 curriculum. Most medical schools are 4 years. And so ours will be a 4-year curriculum, but our students will be able to graduate after 3 years if they so want to. In that case, they would stay in one of the residency programs at Hackensack Meridian or possibly some of the other hospital systems, which is great because it means that we will be retaining our students in our state for medical school, for residency. And once people have been in a position, in a place that long, they're likely to stay and serve the community. So we're hoping that will also help with retention of physicians here.